This is a micturition video sitting position. Radioopaque dye has been inserted into bladder, vagina, rectum and levator plate. During squeezing, all the organs and levator plate are lifted upwards by contraction of the pubourethralis muscle which lies below levator plate. During micturition, the anterior part of levator plate is angulated downwards. This pulls down the rectum, vagina and bladder base. The posterior wall of the urethra is opened out or funneled. At the same time, the bladder contracts. It is actually a spasm which continues right to the end until the bladder is empty. At the end of micturition, everything relaxes and is lifted.